ambao mafamilia wengi hapa wametumia kuunda vitu vya mikono ili kupata mapato ya kila siku kama jamvi, kama viti, meza na vitu nzuri nzuri ambayo yanaleta mapato ndio. Ila je, mavuno yao tulipata ya kwamba ni njia ambao si nzuri. Majamii haya hawataendelea kupata hizi manufaa. Kwa hivyo basi hii ilikuwa ni shida na changamoto ambao mazingira inapitia eneo hizi ya ardhi oevu. Mojawapo ya kitu ambacho tulifanya ni kupata vijana kama sisi ambao wako na mahusia kama sisi. Na pia je, tukapata kujua ya kwamba wakati wanauvuna kwa njia ambayo inastahili.
A Universidade de São Paulo se juntou à Planetary Health Alliance logo no início de 2016 e nós fomos convidados a submeter uma candidatura para sediar o Planetary Health Annual Meeting de 2021. A realização desse evento foi marcante para todos, para nós e tenho certeza para a própria Aliança. A redação da Declaração de São Paulo, um esforço da comunidade global, e o seu resultado também me inspiram muito. Eu tenho certeza que a Planetary Health, como um movimento, é um arcabouço poderoso para promover as mudanças grandes, importantes e factíveis, possíveis, que nós precisamos. Eu sinto que o movimento acolhe as pessoas. Na verdade, muitas pessoas no grupo aqui do Brasil, ao entrarem no grupo, dizem, literalmente, encontrei a minha tribo, o meu grupo, eu faço parte dele.
We discovered that less than 20% of the students that participated had proper knowledge of waste management. So we developed Heart from Scrap to help combat this. We engaged about 200 participants and they were tasked with making at least one recycled item from waste material. We were able to achieve a change in mindset in a considerable amount of them. I feel motivated and inspired to carry on bigger projects and share bigger success stories.
Traveling is not only costly for the individuals, it's also costly for the planet in terms of environmental issues, pollution. With COIL, all students sit at an equal table. They all have a way of getting the opportunity of internationalization in their studies, increasing their knowledge and competence in their global approach and cultural sensitivity. In short, our coiling has been a success. With more than 300 Icelandic nurses and almost as many nurses in the US getting the opportunity of international study without ever traveling.
We encounter the planetary health challenge in the faculty. Everyone in the faculty do not perceive the same goal of sustainability. We began with 4 keywords of goal: collaboration, awareness, and action. We address the issue of reducing waste by properly separating trash. The core curriculum activity of Planetary Health was designed out of the classroom for the student. The outcome of the activity is reducing waste by decreasing of the pollution, improving public health issue, and enhancing community engagement. We are continuing to sustain planetary health, including integrate into curriculum, organize regular events and workshops for everyone. The faculty is where global change begins. Let's start with you, your community, your world.
The catastrophic floods that year submerged 1/3 of Pakistan, affecting over 33 million people. I knew I had to be part of the solution on some level. Soon after, I became the campus ambassador for Planetary Health Alliance. We launched projects that promoted the zero waste culture across NUMS and not just the campus but the nearby community as well, while showcasing our all sustainable products, zero waste models and awareness campaigns. Small actions, when multiplied, always lead to a bigger change. Because the truth is, we just cannot have healthy people on a sick planet.
I launched a research initiative at Boston University called the 51% Project to identify science-based principles and best practices for climate communication. I co-directed a year-long multidisciplinary inquiry on climate mis and disinformation in social media, which is rampant. I collaborated with Princeton University behavioral economists. We formed a team to assess the leadership of major banks on this. And along the way, I've served on the boards of several excellent organizations. And at the top of the list, of course, is the Planetary Health Alliance.
At our center, so we are taking on the challenges of the advancing the transdisciplinary approaches in planetary health. Our team includes the researchers from diverse fields such as ecology, engineering, environmental science, architecture, transportation, and health sciences. We issued the Hiroshima Planetary Health Declaration 2023, titled The Pursuit of Peace under the Great Transition, Education and Research for Planetary Health Science with Society. So we are still expanding our network, but the Planetary Health Network in Japan is steadily growing. Many young students and researchers have also joined us, adding the fresh energy and a perspective to our work.
The American Nurses Association, which is our largest professional organization, has adopted Planetary Health. Our code of ethics now has planetary health worked into it. Provision 10.5 is where you can find planetary health. Internationally, the International Council of Nurses has decided that planetary health is a core principle of nursing practice. This is who we are. This is the core of our profession, and now we're bringing it out into the world. I cared for very sick systems, health systems, and now I'm nursing the planet. I hope everyone will join us.